Hello, my name is Dr. Gilles Salles from Memorial Sun Catering in New York, and I have been dedicating my whole career to the treatment of lymphoma, more specifically B-cell lymphoma, both large cell and more indolent ones such as follicular. I think we are living really an exciting time where, we have been moving away from simple chemotherapy or high-dose chemotherapy. Rituximab was the first major improvement 25 years ago. We have seen then cellular therapies such as CAR T-cell, and now we are seeing bispecific antibodies. Each of these drugs have allowed to do meaningful progress, and I think that at the same time we have a better understanding of the different molecular subsets of B-cell lymphoma, understanding a better classification, and probably allowing us to design specific therapies for specific subgroup. So my group on Memorial is working in these different areas, including how to optimize the use of bispecific antibodies, introduce them in the first-line setting, for instance, of patients with follicular lymphoma. We are also doing ex vivo and in vitro study to try to clarify the mode of action of these bispecific. We are also analyzing large cohort of patients for the molecular data, trying to better understand what are the treatment they need to receive. Again, it's a very exciting time, and while we don't cure all patients, I think we made substantial progress, and I do hope that we'll continue to make so. And this is an effort of the whole community, whether they are in the United States, in China, or elsewhere in the world. During this ASH meeting, I presented the 5-year update of the POLARIX study, which was a study that compared R-CHOP with Pola-R-CHP. And we saw that with 5 years follow-up, we have a sustained benefit in terms of progression-free survival. Still no overall survival significant difference. Although numerically, we see less deaths from lymphoma in patients treated with Pola-R-CHP as compared to those treated with R-CHOP. So these are encouraging results. I think there were many phenomenal studies. A colleague from Beijing in China presented a way to modulate the microenvironment to increase the efficacy of bispecific antibodies. In the plenary session, there was the role of ketogenic diet to improve the efficacy of CAR T. So I think many areas and many ways to improve the current immunotherapies. I think they will impact treatment for sure. I mean, there is a lot of things going on in terms of diagnosis. Molecular classification have improved and may enable us to be more selective in applying some of the drug to selected patients. I think, as usually at ASH, we meet a lot of colleagues. We have the opportunity to interact and discuss progresses. I think what has been very interesting in recent years is that the activity of new agents and new drugs shown in clinical trial were also reproducible in clinical practice. I think we have heard a lot of things regarding CAR T and how the result of clinical trial are transposed to real life. So I think we learned that the progress that has been made with the discovery of new drugs, with a better understanding of the disease, with the clinical trials, also have impact in the general population. And I think this is one of the current message that we hear during these meetings.